Hello everybody. Today I'll be talking about approach to hypercalcemia. Now, if you have a patient who have hypercalcemia, the first thing you need to measure is the parathyroid hormone level. If parathyroid hormone level is high or normal, then you have to proceed to measure 24-hour urinary calcium excretion, and sometimes you can add on calcium creatinine ratio. If that's high, then you are dealing with primary hyperparathyroidism, which is one of the most common cause of hypercalcemia. If it is low, then you are dealing with a genetic rare condition called familial hypocalciuric hypercalcemia, which is basically autosomal dominant condition, and usually it's a mild disease. Now, if the PTH level is low, then you have to think about parathyroid related peptide, like a condition of paraneoplastic syndrome. You should also consider vitamin D toxicity. Now, other differential diagnoses that you have to consider in such cases, like bone metastasis, ectopic production of calcitrol, like in cases of granulomatous diseases. Now, what is the treatment of hypercalcemia? Treatment of hypercalcemia always based on the level. If it is mild or chronic, then oral hydration, avoid medication which cause hypercalcemia, and thiazide diuretics is a common drug which can cause hypercalcemia. Now, if the calcium level is severe or patient is symptomatic, then you have to probably admit him and consider aggressive IV fluid. Loop diuretic can also be considered after fluid repletion in patient with heart failure or CKD. Calcitonin can be used, and it can be repeated every 6 to 12 hours. IV bisphosphonate, and mainly pomedronate, can be given as a dose of 60 to 90 milligram in IV fluid. It is very important to monitor the renal function tests when you give bisphosphonate. Cardiac monitoring is very important, as hypercalcemia can cause short QT interval, which can cause arrhythmias. Consider hemodialysis if patient is suffering from kidney failure or heart failure or severely symptomatic. Another agent which I will never forget to mention is cinacalcet. Cinacalcet has been approved to be used to treat secondary hyperparathyroidism in patients with CKD on dialysis. It also has been approved to be used in patients with hypercalcemia due to parathyroid carcinoma. Cinacalcet can be also used in primary hyperparathyroidism who are not suitable for surgery. The mechanism of action of cinacalcet is that it interacts with the calcium receptor on parathyroid cells and thus decrease parathyroid hormone release. And they sometimes called calcinomimic. So if you have any comments, please write them below. Thank you.